to everyone to Maywalk's second Equity Forum. And my name is Brenda Jenkins. I am one of the co-founders and visionary from Massachusetts Women of Color Coalition. And I want to recognize our esteemed panelists who I will be introducing. Well, they will be introducing themselves in a little bit, but I also want to introduce our CEO slash visionary president, Celia Blues, that she'll talk a little bit about Maywalk, and then we'll go right back into introducing our panelists with Dr. Sarah Perez McAdoo and also Vanessa Jordan and Cassandra, our special panelists who are working closely with Maywalk. So Celia, would you like to talk a little bit about who Maywalk is and our vision?
Yeah, thank you, Brenda. Good morning, everyone. Really excited to have you with us here today. Just briefly, our mission is around eradicating racial inequities amongst women of color created by structural, institutional, interpersonal, and internalized racism. We address these inequities along 5 platforms. One, which is what we're all about today, is the health and wellness platform. We have the economic power and sustainability platform. We have our education justice platform. We also have our criminal justice reform platform and our politics and civic leadership platform. So that's like the platforms that we do our work under. So excited to have the health and wellness platform today that we are going to be hearing from our esteemed panelists. Just want to share with you that we've been existed now for 6 years. We're very much a grassroots organization. As Brenda mentioned earlier on, her and I are the visionaries of the movement. We have 12 other women of color that were a part of the initial groundbreaking, it's kind of strategic planning that took place to bring us here today. And we're really thankful and grateful for them. And it's excited that we've already grown our movement to almost 400 members across the Commonwealth. And we've yet to do a communications and marketing planning and strategy. So very much looking forward to our next phase and with you all here with us today. I just want to highlight a few things that's coming up, and then we'll turn it back over to Brenda. We have an event coming up on May 13th with our partnership with the Treasurer's Office, the state's Treasurer's Office, around our economic power and sustainability platform. We have a series of roundtables events happening around equal pay. We have an event on May 13th from 11 to 12 that got posted last night on our website, on our Facebook page. Our General Counsel and Vice President Maria Rivera Cota will be on that panel. We also have our healing, we call it Healing to Lead series intentionally, because with this work that we do and with our everyday lives and the inequities that we face every day, there is a piece of us that we always want to make sure that we're doing the self-care and the healing work that we need to happen. So we have that session coming up on May 19th, and then our partnership with UMass Center for Women in Politics and Public Policy on May 24th. We have the unveiling of the Women of Color elected officials across the Commonwealth, which will be a major event that we want to highlight for you guys. So lots of things coming up, and we hope that you will join us. And with that, I will turn it back over to the MC. Brenda.
Thank you, Celia, for sharing that information. The Health Disparity Platform, we thought it was so important that we actually provide information on the coronavirus, as well as talking about the importance of a strategic campaign that we see going across the country to get BIPOC communities vaccinated. And as we're learning, you see some of the changes and challenges that has happened with Johnson & Johnson's vaccine, but right now we're happy to hear that got reapproved and it's back out there, providing some intervention for some families and communities. But we also found through that interruption, there have been hesitancies in BIPOC communities to go back and follow up with some of the second vaccines, as well as getting vaccinated, period. And we thought it would be important to have our panelists, come and talk about their area of expertise and talk about the importance of why this vaccine is important and how it impacts BIPOC communities, and then talk about the hesitancies and may have a lot to do. Some talk about generation of, the Tuskegee, different things that they're hearing, not understanding the importance of science. And so with that said, what I like to do is introduce Dr. Sarah Perez McAdoo and our Jordan and Cassandra to talk a little bit about themselves before we go and ask them the questions about this vaccine and the coronavirus. Dr. Sarah McAdoo.
Good morning, and it's an honor to be here. Every time I join, I also learn a whole lot, so I appreciate this opportunity and engaging in this conversation that's so incredibly important. Health and well-being overall is critically important to our communities of color, so I am delighted to be with you today. In terms of my background, I am a public health physician. I trained as an obstetrician gynecologist, and during my training, I felt that it was incomplete. There was a whole lot that I still felt I did not understand because my communities that I serve, underserved communities, Black and Brown communities, was still struggling and realizing that medicine wasn't going to be the complete solution to some of the concerns that I was seeing that people were experiencing. So I pursued a master's in public health, and I shifted my work from individual patients to communities as a unit of care, and really looking at the factors in the community that influence your health. So that has been sort of my trajectory, very long, but that's the short version of it. And that means that during this time of COVID, I'm looking at equity in the impact of COVID to the communities before. What were the underlying conditions before that led to these inequities in the outcome of COVID? How we are currently managing that, and what will this look like after? How are we going to address these inequities even after COVID? So that's sort of the perspective that I've been taking in my work, looking at the future health and prosperity of our communities of color. And COVID is one segment that has put a highlight on that I now have the privilege to work with others, including our wonderful students at Jordan and Cassandra here today. So I am delighted that I'm able to be in this panel with them today.
Thank you, Dr. McAdoo. Jordan, would you like to talk a little bit about yourself and why you're here and what you're working on with Maywalk?
Sure. I'm a first-year medical student here at UMass Medical School. Cassandra and I are here right now. We both studied microbiology undergrad, and we were just really passionate about bridging healthcare disparities and representation in the medical field. We're really excited to be here with Dr. McAdoo. She's been a great mentor to us, and hopefully just give you a bit of our experience and answer any questions you guys have about the vaccine.
Awesome. Cassandra?
Yes, as Jordan just said, I'm Cassandra, also a first-year medical student, and me and Jordan are part of the PURGE program here, which really focuses on people of color as well as marginalized, underrepresented individuals. So that's something that we've definitely been interested in before we even came to medical school. As one of the too few individuals here that are people of color, by here I mean UMass Med, we definitely take an interest in this and just try to do better for our community and the UMass community.
Awesome. Awesome. We're going to actually ask Caroline to open up. She's going to start with 2 questions per panelist. Caroline.
Thank you so much for the introductions and the information delivered. We appreciate you. Thank you. Can you hear me all well?
Yes.
Okay, so I would like to start the questions, 2 questions to Dr. Sarah Lopez McAdoo. The first question, how do the COVID-19 vaccines protect me? And then the second question will be, how do we know that COVID-19 vaccines are safe? And if you want me to repeat the questions, I can do that too.
Thank you, I'd appreciate that. The first one, how do they protect me?
Oh, you're muted, Dr. McAdoo.
Sorry, thank you. Thank you for the question. And Celia, I might ask you, but I'll start with the first one. How does the vaccine protect you? Our normal immunity, in most normal cases, in a healthy individual has the capacity that when they see something foreign that comes to the body, a bacteria, a virus, it mounts an immune response. it begins to recognize that and know how to respond to it by producing antibodies and other things in your body. In this situation, your body with the vaccine, a certain piece or element, a message, they call it a messenger RNA, that is for the Pfizer and the Moderna. In that situation, it's giving the body some information to begin to produce the antibodies that you need so that it recognizes that virus if you do receive it. So it's prepping your body and getting it ready. It's sort of like, if you know what the what you should be concerned about or alarmed about, your body starts getting prepared. If indeed you do see that virus, it gets introduced, your body is able to quickly have an immune response and is able to protect you from severe disease. So you're looking at really causing significant illness that requires you going into a hospital, going on a ventilator, or even dying. So by getting the vaccine, it preps your body and gets it ready to prevent severe disease. Okay, so in that situation, you are already giving your body a head start. So that is how it protects it. It's, and you now may see a few times, you might hear a message that someone who got the vaccine got COVID. The issue is not so, yes, you want a vaccine to be 100%, never get anything, but the real purpose, if you really are thinking about it, is to prevent severe disease. Because if a person gets it but have no symptoms, they're going to get through it. But we're really looking to prevent a person from getting hospitalized, from having any kind of long-term problems related to that really impacts your life in such a way that you might not be able to go to work or maybe be able to study or take care of your family. And in the worst case scenario is losing lives. And in Black and Brown communities, because unfortunately, we disproportionately are impacted by some of the chronic health conditions, it makes us vulnerable to this virus. So getting the vaccine gets our body prepped and ready. So if we do see it, it does not cause a severe disease. So that's in a very general term, and that will look differently a little bit for everybody. But that's really in general how it protects us. And that's how a lot of vaccines work. It kind of just gets your body semi prepped and ready to go. The second question to that, Celia, can you repeat the second one?
Of course. And this is Carolina, just so you know me.
Oh, sorry, Carolina.
No,
I
that's
apologize.
absolutely fine.
I'm looking, I'm looking at Celia's little frame, her picture is right next to yours, so I'm seeing her. Carolina, I apologize about that. So.
No, that's fine. I haven't been able to change it, but it's okay. So the second question is, how do we know COVID-19 vaccines are safe?
So we know what we know now. So in other words, there is a lot of information that is letting us know that the vaccines in general are very safe for the general population. And we know that because when a vaccine is utilized, you have like places like the CDC and other government agencies, state agencies that are monitoring the side effects that people are reporting. And some of these side effects that you might have heard already are things that we would expect. So in general, some people might have some soreness after it, might actually feel somewhat ill and may have to stay home from work or from school, but that might be that they might feel like they have a headache or maybe feeling a little achy or just feeling generally sick. But this is a temporary situation, they get better afterwards. In cases where there are more severe reactions, like if I am someone who may not have had this before, but ends up having a severe reaction, those things are recorded and they track this information and they track it closely to make sure that they're seeing whether this is an isolated incident or maybe in a very small number, or if this is something that is very concerning for a larger group of people. So there are things that are in place through the CDC, local health department, you have state health departments, you have several layers of organizations that are tracking any kind of adverse events that could be something that they might be concerned. At the moment, we're not seeing that. So overall, we're seeing that for the general population, these vaccines are safe to use and protects people from the worst outcomes of getting the disease. So although I know that I said that in very general terms, but I just want to explain that there's a system in place that's monitoring these side effects really very closely to make sure that it's not something that is concerning for the general public. So when they see these small clusters of some of these side effects, they stop for a moment. That's normal to pause for a moment and say, hey, we're beginning to see a few cases. We need to understand this better, ask more questions, look at the person's underlying conditions, look at the whole situation, look at what has happened, and then figure out whether that's something that is isolated or larger. But right now, what we see is that the vaccine are safe for the general population.
So thank you so much, Dr. Sara Lopez McAdoo. I would like to continue with the questions, and this time we would like to talk to student Jordan. So the first question is, what do you suggest someone do in order to encourage them to get the vaccine? And the second question, and I can repeat them later if you want to, is what should I expect after getting a COVID-19 vaccine?
Sure. So going with the first question, you said, what should people, how should they know if they should get the vaccine? I think it's an important conversation to have with your own doctor. Everyone has their own set of health circumstances and different medical things going on. So definitely important to talk with your own doctor if you're concerned. Definitely it's fine to do your own research on the vaccine and make sure it's something that you feel comfortable getting. There's a lot of good resources. The CDC has a great website that has really digestible information, makes it easy for anyone to understand the different types of vaccines that are available and what to expect as far as side effects or what to expect when you go in to get your shot. I think it is a personal decision. No one should be forced to get the vaccine. So definitely feel good in your own decision to get the vaccine and have a conversation with your own doctor.
What should I expect after getting a COVID-19 vaccine?
I can give you guys my experience when I got the vaccine. It's not going to be the same for everyone, but when I got my first vaccine, I got the Pfizer vaccine. My first vaccine, I didn't have any symptoms. I felt fine the next day, didn't have any issues at all. I felt completely normal. And then after I got my second dose, the next day I had like a headache and my arm was sore and I kind of felt like fatigued, like a little bit run down. Lasted maybe 10 or 12 hours and I was fine by that night. So I think on average, if anyone gets any symptoms, they're pretty mild: headache, fatigue, arm soreness, just because they got a vaccine. And just so everyone is aware, like when you do go to get the vaccine, they make you wait 15 minutes after you get your shot to monitor you for any side effects or adverse reactions. If you have a history of reactions to vaccines, they have you wait an extra 15 minutes. So you're there for 30 and they just keep an eye on you. There's medical professionals there, doctors, EMTs at every vaccine site I've been to personally for myself. And then also to give vaccines, there's always medical professionals there in case anything were to happen. Never seen them used, but they are there in case anything happens.
Thank you so much.
Yeah.
So we're going to continue, and I know that at the end we have a space for more questions. Cassandra, Jean, Marie, who should get vaccinated for COVID-19? Who? And then the second question is, how do I get vaccinated against the COVID-19?
I think the first question is really good. My understanding is that everyone who is able should get vaccinated. So there are definitely populations of people who are severely immunocompromised. And that's a conversation that you definitely should have with your doctor, because certain immunodeficiencies you can get vaccinated and certain ones, they may have you wait until your CD4 count is increased, which is just like natural T cells you have to fight diseases. So I think that's definitely a conversation. But right now, I think you can only get the vaccine if you're 18 or older. And I think they're changing those guidelines as the year progresses. But I think if you're comfortable, then everyone should get vaccinated, because what we're really looking at is herd immunity. So people who can't get vaccinated obviously can't get the vaccination, and they're at an increased risk for getting sick due to COVID. However, if everyone around them is immunized, then they have a severe, like, decreased chance of getting the vaccination. So anybody who is able and willing should definitely get vaccinated. And if you do have certain chronic conditions, so different immunodeficiencies, definitely have a conversation with your doctor, because even in certain cases, you can still get vaccinated. but everyone who is able. Children right now, I don't think are indicated for getting vaccinations, but as I said, things are changing every day. So definitely check the CDC, the World Health Organization, talk to your doctors, healthcare professionals that you trust.
Thank you so much. How do I get vaccinated against COVID-19? Have we answered that question already?
I think that's also a good question. And I think this is for someone who's been vaccinating at different sites. So Worcester versus Springfield, and my family lives kind of in Lowell and Methuen and Medford. There are so many different avenues to get vaccinated. So some people are getting it from their doctors. So you can contact your doctor, set up an appointment that way. Some like primary care physicians are not seeing patients right now, like in their office, they're only doing telehealth visits. So in those cases, you can sign up via CVS as well as Rite Aid. So that would entail going onto the website and signing up that way. I know a lot of people are trying to get vaccinated in those ways, so I know the wait time can be quite increased. You can also see if you're a local hospital. So I know Lawrence General as well as Lowell and the hospitals around here have sites that you can go to and sign up. And we can also send out that information for like a direct link if people are interested. And you can also go to your your Department of Health website, and they always have links to get vaccinations that way. So there are many different sites across the country that are holding vaccination sites. And it is also free. And I think that's something that maybe some individuals don't know is it's free of charge. They do not ask you for your insurance card or anything like that. They just want to make sure that if you do have like a medical condition, just let whoever's vaccinating know that so they can tell you any extra information if needed.
Thank you so much for this valuable information. We have more questions. So salgo continue, Brenda? How do you want
Yes,
to continue?
absolutely.
So there is a very important question as well that I want to throw out there. Can I choose which COVID-19 vaccine to get? If any one of you want to answer this question. Can I choose?
I think, so that's something I've encountered. Oh, Dr. McAdoo, I'll let you take this since you're the leading expert here.
No. You go on. I'll catch on with you. Don't worry about that. You're good.
Just my understanding, because we have been giving vaccinations. So sometimes at the vaccination site, they only send one type of vaccination. So they'll send Moderna, they'll send Pfizer. So if you go there that day and they only have Moderna, so that's the vaccine, not you would have to get, but that's the one that they're giving that day. What you can do is you can talk to one of the supervisors leader and maybe ask if they're gonna get sent a different vaccine if you want a different one, but both of them are pretty efficacious. They're very similar to each other, just different companies make them really. But so when you go to a vaccination site, you really cannot choose which one you get because we don't have all of them on site at the same time.
But what can add to that is I know people are asking that question very often. The thought is get a vaccine. All the vaccines, just as Cassandra mentioned, are all effective. The goal is sooner than later. So in thinking about whether I should get the vaccine, my thought process, and this is something even on the CDC website that it recommends, you're asking yourself two questions to begin. One is thinking about what is my risk of exposure? So for example, if I am someone that works at the front line, and you can tell because that's how they start to vaccinate, people who are right there in the front line. So if I am working at a local grocery store and I'm going to be around people a whole lot, and I don't have a choice, I got to get to work, then I have to think about, okay, my risk of exposure might be a little bit higher versus someone that can stay and work at home, right? And the other thing is thinking about risk of severe disease. So if I have asthma, but my coworker does not, I may be more at risk of getting severe disease if I get it. You're thinking about those two things in deciding to get the vaccine. So whichever one is closest to you. So as Cassandra said, in these different locations that are happening, you can see the locations at the statewide level. So the state previously had these like mass vaccination sites. Then you'll see them sometimes at the state, not the state level, at the city level, a city level or a town. And then you might see them at the neighborhood level. It's just as Cassandra was saying, like the CVS, the pharmacies are now popping up. Go get one. So if you feel that you want one, go get one, regardless of which one it is. Because the most important thing is to have it on board because we don't know sometimes yet. We haven't figured out, except for people who have some chronic underlying disease. If I'm a person who does not have any, but I get it, there's things about my health I may not even be aware of just because I haven't been sick, and I don't know how I'm going to react to this new virus. So if I have access to the vaccine, which one at this moment does not truly matter which one you get, as long as you get the series of vaccines. So as Cassandra mentioned, if you end up going to a location that is giving Moderna, that's 2. If it's Pfizer, that's 2. If it's Johnson & Johnson, that's 1. So you just have to make sure that you do the complete series so that you are fully protected. And that's the most important thing. So I think this is a tough situation because it's not picking and choosing, it's much more getting the vaccine. And the easiest way that you can find to do that, and in public health, is sort of we want to make the right thing the easiest thing to do. So if there's a CVS at the corner of my house and they're giving Johnson & Johnson, or they're giving Pfizer, whatever they're giving is what you should get. Saying that, everything that Cassandra and Jordan has mentioned about thinking about your own personal health, having those questions, that the best thing to do is to communicate with your doctor. Or, that I think is important when there are special circumstances that you want to ask questions about that is relevant to you. So there's some things that we are sharing that's going to be very general, because that's we're not giving medical advice for individual people, but as Jordan had mentioned, the best thing to do is if you have some more specific questions about your health is to contact your doctor. But the goal is to get the vaccine. You want to be healthy, you want to stay safe, and you want to keep others in your family and in your community safe.
Thank you so much for your insights. Very valuable and very, very useful to all of us. We appreciate that. Thank you. One question that I would like also to ask you, because it's also very important to think about it. Some people will choose not to get the vaccine. So how we should react about that? Or what do you say to those people who choose not to get the vaccine?
I think it's important to know that you getting vaccinated also helps the people that are choosing not to get vaccinated or can't get vaccinated for whatever reason. So just by you doing your part is also helping out them and yourself, because you're helping build herd immunity. I think coming from people in the medical field and like hoping to become doctors one day, I think a lot of our attitude towards people who are not wanting to get vaccinated is to try to understand why they don't want to be vaccinated. Some people have medical conditions where they can't get vaccinated, no fault of their own. Other people have been given misinformation, or they're just really worried for plenty of valid reasons about getting vaccines. So I think it's just important to understand where people are coming from and help provide them with resources of trustworthy and quality, most up-to-date information so that they can make an informed decision for themselves. Can't force anybody to get a vaccine, but if you can provide them with good information, I think like what we're trying to do here today, they can make the best decision for them. But again, you can't force anyone to get a vaccine. I don't think it's good to respond with hate or anger of people that want to get vaccinated, but just provide them with good information.
I think that's a really, really good point. I think the term that we definitely use is vaccine hesitant. And I say that because if you asked me in August of last year or in July, I wasn't one of the first people that wanted to sign up and get the vaccine. And I think that's definitely coming from a different place than a lot of my classmates. They're like, oh, the second it comes out, I'm going to get it. And me, I was like, I'll wait a week or two or a little bit to get it first. So what I had to do personally, because I feel like I was on the other side of that line last year, a year ago, first, I definitely looked at the devastating toll that COVID was wreaking havoc on the entire world, and I'm not immunocompromised. So one thing, and this was a decision, again, I had to make for myself, and I think that's important, is it's going to be case by case, different decisions. You never know what someone's going through in their life. You never know what they went through in the past, and there may be an amazing, valid reason that they're not getting the vaccine. So I had to figure out what was best for me. So one thing I did was definitely do my own research. So I started to talk to doctors and scientists and really figuring out information about the vaccine. I think one thing that we always hear is this vaccine came out so fast. How did it come out so fast? And that definitely was one of the questions I had. And one thing I learned through my research is the science behind the vaccine is actually not new. So mRNA, using that in vaccines, that is not brand new. We didn't come out with that this year. The way we're utilizing it is kind of new, but that science has been in the labs for a long time. And I think another thing that people often say is we have a lot of different diseases and we have no cure for that. And how come we don't have cures for that? And we have, like, right now we have a vaccine for COVID, which is not necessarily a cure. And I think one of the prime examples people say is HIV, which is ravaging a lot of individuals, especially people of color. And I think I had to delve in deeper into the science of that. I do know a lot about HIV, so it has a lot to do with the fact that it's a retrovirus. And there's different, they're not like necessarily the same category of virus. And for that reason, we have the science to help one, and we're still trying to figure out the science for the other. So delving into the science and taking that science from reputable sources was something that I had to do. But my main reason for getting the vaccine was my mom. So my mom became immunocompromised last year and she wasn't able to get the vaccine. So I was very terrified that when I was in class, when I went to the grocery store, because I was the one that was doing the grocery shopping, that even if I happened to get COVID, I was sure that I was going to be okay, but was she? So I really did it for a loved one. And I think that's one thing that when you're talking to individuals, one, give them the science. So talk to them, what are your concerns? And then help to pinpoint their different concerns, point them towards the right direction. If that's a doctor, a scientist, paperwork. Number two, ask them about maybe people in their family. Is anybody immunocompromised? Are they worried about giving COVID to somebody else? Are they worried about getting COVID themselves? So definitely having these conversations about the things that are important to people, I think is a great place to start, and just being absolutely transparent, because that hasn't always been the case with people of color in science in the past, and I always want to recognize that. So it is not a ridiculous sentiment to be vaccine hesitant, and I think that's something that I try to speak on a lot.
Thank you so much. I don't know if Dr. McAdoo has something to add.
They are wonderful. Jordan and Cassandra answered it wonderfully. And what I love about their response that's incredibly important is, one, the acceptance that we understand why people could be hesitant, that there's that sort of respecting that people still have a lot of questions, and approaching that from a question, not an answer. So in other words, they both said in their own way, sort of asking why. What are you concerned about, or where is this coming from, to meet people where they're at, because everyone's different. And at the same time, as Cassandra mentioned, fundamentally understanding that our communities of color, have experienced healthcare, unfortunately, historically, and even currently, not necessarily from a perspective where they are prioritized or that their needs are prioritized, and have had significantly negative experience. And a lot of them is, fueled from systematic racism. So we understand that. So, being mindful that people are different in their journey of how comfortable they feel with this vaccine is important to pause. So they, as doctors in their professional development, understanding, becoming physicians, they're going to know a lot of information, and that's great. But how to be able to take that information and help an individual understand it, process it, and then meet their needs, I think are skills that then enhances the science that they are, that they're developing. So I love how you both have answered that question. I appreciate how you are open to meeting people where they're at. And I think that is the way that you approach it, in order to really be able to give people the tools, information they need to make the right decision for themselves.
So thank you. Brenda, I think you want to add. There is time for more questions, or we pass?
Can you hear me?
Yes, now we can hear you.
Hello?
Yes.
We can hear
I don't
you.
know if you can hear me.
We can hear you.
I wanted to say excellent answer. The other thing I wanted to add to that is really to talk a little bit about the third shot. They're talking about booster for Pfizer and Moderna. And a lot of people are really concerned getting that third shot. And also, I'd like to hear a little bit more about, would this be an annual vaccine that individuals would have to get every year?
So one of the things that both Jordan and Cassandra had mentioned is we're still learning a whole lot from this virus. Sorry. The information that we have right now, we just started vaccinating. So we're just trying to see how long this immunity will last. We don't have 100% understanding. So there is the potential that that might be the case where we have to receive an additional a booster, or that it might be annual. We don't know 100%. Studies are going on right now to figure that out. What I think I can remind, I think many of us is, you know, our vaccine experience, right? So when we go to the doctor, we get a vaccine. Sometimes we have to get a series a few times in order to be protected. Sometimes we have to give one more later on, you know, in order to continue to be protected. And the flu vaccine is a great one, right? That is something that is offered every single year. And it's very similar reasons. There's some people who may have some underlying condition that if they get the flu, it gets very severe and can cause them pneumonia, being in the hospital, people can die. But having this booster every year has to be changed because that flu, that particular one could look slightly different. So there's, I'm not going to give a concrete answer like, yes, that's going to happen, but they are looking at that and there is the potential that might be the case, but that is not that much different than other vaccines we have previously received. And the flu vaccine is an example of that.
I think like going off of what Dr. McAdoo said, it's like similar to the flu shot and how we get a different flu shot every year due to different strains that are more popular every flu season. I think we're kind of seeing that now in different countries, different areas of the world. There's different strains that are becoming more common. So I think another thing that what might potentially be a reason for us need to get boosters is different strains emerging and wanting to make sure that the vaccines that we're getting are effective against all the strains or the strains that are the most causing the most harm. So I think another reason why herd immunity is so great, if the vaccine isn't or the virus isn't bouncing around a community, there's less chance for it to mutate, less chance for new strains to come out that will be that the vaccine won't be effective again. So another reason why the vaccine is super important.
I also think Dr. McAdoo definitely made a great point in terms of we have a lot of boosters for a lot of the vaccines that we've had to take our whole lives. And in some cases, like I feel like I've got the meningitis vaccine every year since I started college and even now because you're in close quarters. And the booster is really just so we can make sure that our antibodies, which is like our fighters and our cells, are just at tip-top shape to fight whatever is coming into our body. We just want to make sure we have enough of them to combat the disease. So definitely, I think another thing we often talk about is sometimes like the side effects for the vaccine. I honestly thought my meningitis vaccine that I got like 3 years ago was much worse than the side effects I got from this one. But as Jordan said, I had a little bit of chills. I wasn't feeling great, but I feel great now, but I wasn't for the first one. I think that I was a little different. That my first one is when I felt kind of sick and I felt completely fine for the second one. I like to think that my immune system was just very robust and it wanted to fight it off the first time and not the second time. But that's one of the reasons we definitely get boosters is so that way I was feeling during the first vaccine is much better than people who get COVID actually feel. So I think that's one of the things I like to keep in mind is whatever I was feeling, it's nothing compared to the people who are in the hospital, possibly on ventilators, things of that nature. So I think it's definitely very important to get the booster, and that may be something that's in our future.
Right. I think it's important, and then we can open it up to the our audience. I think what's important, I like the fact that listening to, it's important to meet community where they're at, individual where they're at. And because the way you're trained up through medical and science, you know, community don't have that same mindset or lens or to where you're being trained. One of the things I think it's important is science is important and research is important. I think we need to find a way, the same way we did the strategy of campaign for BIPOC communities, we need to do it the same way to get BIPOC communities involved in research. And I think if we do that, I think that you'll find less hesitance when, you know, we're actually addressing this particular pandemic. And I'm quite sure there will be other, I hope not, other pandemics, you know, to come. But I think to do that would be to have a campaign of getting BIPOC communities involved in research, be part of that. So I think they'll have a better understanding, and we don't have a lot of BIPOC community individuals part of research today. So, and I think information knowledge is power. And I think when you can provide those type of resources into those communities, I think you'll find more people will be more receptive to receive these vaccines.
Oh, Brenda, you just hit it out of the ballpark. Absolutely. I completely appreciate everything that you shared, because that means communities are engaged in being part of the process, right? Instead of us just saying, dumping all this information and this is what the science says, check off all the boxes. So science says this, so you have to do that. You have to be part of the process. You know, and something as even in community engagement strategies, right? People tend to own and to engage that they're part of building. So more people that are involved in research. And in fact, the research for these particular vaccine had more than previously people of color. And that was unique and that was purposeful, so that to give a little bit more diversity and understanding, which should be the case for all, but they made it a priority for this, for the reasons that you mentioned. And in a quick example I can show you, not related to the vaccine, but with the way that Jordan and Cassandra are experiencing their medical education. Part of what we're doing is that to bring the community expertise into the conversation in education as experts, so that it is part of the process and they're educating their future doctors in their communities. That is different than having the traditional academic faculty say, this is everything you need to know and go do it. Instead, what we're trying to do differently in their education is bringing the community as part of that education process. So that Gordon and Cassandra, in their way of thinking, their approach is completely different to how they translate the biomedical science that they're learning into the communities that they are taking care of, that it is a partnership, it is integrated, and it's so intimately woven into that you can't even see the separation between the community and academic medicine. That's where we want to get to be. So you're absolutely in research, and there is the community participatory research that has grown over time for that reason, but there's more that we can do. If community is part of building this system of health and well-being, because health doesn't occur in the hospital, it doesn't occur in the doctor's office or your nurse's office, it occurs in the community. So you can't disconnect those two things, they have to be integrated. So the comment you made is so much bigger than only in research, that we're hoping that in the way that we have designed Jordan and Cassandra's education experience means the community is part of it. So we have a Bay State community faculty that is recognized as bringing the lived experience and expertise from their own life experience into education. So if we can do that in how we deliver healthcare, and there are places that are doing parts of that, so whether it's an advisory committee, but we want to engage people not just from to inform us or be involved, but be empowered within and even lead. So the different levels of engagement. So we want in designing our education curriculum for Jordan and Cassandra to be the excellent physicians that they will become, is that the community has to be part of educating them.
I agree.
So that's how we are approaching that. So you're absolutely right. If we can bring in the community more and more to the back end, the part that you don't see behind the scenes, the community owns that part, right? As part of it, they own it. Then they know the kind of doctors that are being produced, educated, and that they're part of that process. And then that means that end product, the individual, the way that Cassandra and Gordon are going through their professional development. So they're going to learn all the facts. How they deliver it to the communities they care for is what's different. And that means the community has to be part of that process. So I apologize to go on there, but it's a really important part, I think, that we can make the best vaccine, but if the community is not ready, receptive, or understanding, then this vaccine sits in a shelf, right? So the miracle of science did what it was supposed to do, but now how do we actually get that to people is what Gordon and Cassandra also have to learn to do, in addition to the biomedical science that they're learning. So bringing the community on there from day one of their education means that they will learn how to do that very early on.
Thank you. Thank you. Caroline, we can open up to the participants. I didn't know if anyone had any questions.
Yeah, I have a question, and thank you for that, Dr. McAdoo. And this is why we're really excited that they are partners with us at Maywalk, because women of color, especially, have historically been left out of a lot of these types of conversations. So it's really excited to have them along with us and to help us as we grow as well. I do have a couple of questions. The first one is to just touch upon a little bit about you both, all of you actually talked about the historical hesitance. And for those who might not necessarily know about the historical hesitant, while not, not saying to give us a full history lesson, but, there's some key things along historically why people of color, especially Black people, were just not treated well. And this is why there's that hesitant that you all talk so a little bit about. And what is different now in our time with where we are, that is different about these processes that were not that way in the past?
I think it's like Dr. McAdoo was saying, it kind of starts with representation. If people, like, I know UMass in particular is like really making an effort to make sure that the community is represented in the faculty at the school, and they're making a push to increase diversity in their student body as well. And I think it unfortunately has to come from us a lot of the time to demand that we're represented and that people are taking us seriously and have a seat at the table. So I think it's something Cassandra and I are definitely passionate about and striving to like increase diversity in every aspect of the medical field. So I think it kind of, and then once people of color do get to these spots at the table, kind of like bringing your friends along, like my friends from undergrad that I know, people I know in the community, if I can mentor them in any way on how to get involved in the medical field, like I try to do that. I think representation is so important, and that's kind of like that push for representation is kind of helping create that change in the medical field, hopefully in the right direction.
I definitely, sorry, Dr. McAdoo, were you about to say?
No, Cassandra, I can go after you. No, please do share.
I second 100% what Jordan said, like what's different now. So we definitely have a lot, like post civil rights, or I don't want to say post civil rights. So I feel like we're still actively going through civil rights movements, but there's more people that look like us that are in the rooms where these decisions are being made. Sometimes I feel like if you have, and I think we talk about this with Dr. McAdoo all the time, and she will definitely articulate this, I'm sure. If you're in a room and there's just one subset of a population, so they're just white male individuals, their experience will never be our experience. And I think that's what's different now and from back then. So back then, people that look like Dr. McAdoo and Jordan and me and all of you, we weren't really allowed to be in that room. So post civil rights, now we have more rights than we did back then. We're in the room, not as many people as it should be, but we're currently in the room. We're bringing more people along. And sometimes when we're making these decisions, I think it's us that are like, okay, that's not going to work really for people of color because this, and that. So we know the history, we've lived the history. We know what things are going to work in our communities and what things are not going to work in our community. And when you have a room filled with different diversities, of people, different opinions, that's when these true partnerships are being made. And that's when you're getting at every part of the community that needs help. Different people bring different things to the table, and that's why there needs to be different people in the room. And I think that's what's different from then and now, and something that we're still always working on. And I think, again, Jordan said it, I think Sarah said it, I think Brenda, I think everybody here has said it, is how do we bring that information to the communities? And that's one direction, but how can we take the information that we're learning from the community and bring it back to the table that we're at? And I think that's what's so important about Perch, which is what Dr. McAdoo is one of our leaders in Perch, and that's our first introduction with her, is where we have a lot of leaders that are in the community. So we have a lot of pastors and people that are very well trusted, and they're telling us and they're explaining to us how things work in the community. And they give us so much information that we had no idea about. So we're taking that information and then we're applying some of the stuff we're learning in school in science, and we're putting those two pieces together. It's definitely a partnership, and it's not just one way. So it's not like, how do we bring that information back to them? It's how do we get their information, bring it back to the table, and then make more informed decisions on how to help the community. So I think these are some of the things that are changing. Still definitely need to work on it, but yeah.
Right. And so I will just add to that is that's good to hear that, because I think also too, a lot of times at those tables, you know, even those that are in the leadership are providing the teaching and education and training don't have a racial equity lens. And so when you have somebody in those institutions that don't have that racial equity lens, this is where we lose out and miss out. So that's why I think it's important, if we're going to have authenticity in your training and your residency, these is something that has to be transparent in a conversation that continuously has to happen, because in a lot of those institutions, those are not happening. So that's why it's important to talk about what racial equity does, you know, even when it comes to research, when it comes to strategically treating an individual, you know, because you can meet people where they're at, but I think when you're talking about BIPOC communities, you're talking Black, you know, Indigenous people of color and people that may come from different countries, that, you know, we just got to be more culturally, racially appropriate when we're actually addressing these issues.
I want to quickly jump in. I think Shay
Shay,
Jabon has the hand up. Hello, Shay.
Yes, I am here. I'm trying to remove my camera there too. Good morning, everyone, and thank you so very much for this program. I always take pleasure sitting and to listen and learn from all of you. Thank you, Celia and team, Brenda and team, and Dr. McAdoo. And it's so beautiful to see those two young ladies that are in medical school, so passionate. I am telling you, my heart is very encouraged. Thank you so much. And my question that I wanted to ask, I think all of you answered them. It's, you know, as a Black woman, the fear that is going on around, and people are getting better at it, and I'm so encouraged. And also, most importantly, what I wanted to say is that the Haitian population around Boston is working with the American Red Cross to do some vaccination. And I have it, and Brenda, if it's okay with you, I could put it in the chat.
Yes.
One will be in Mattapan on the 18th, and the other one will be in Randolph. And most importantly, the Department of Education and other organization, human resources and so on, are looking and grouping affinity groups. One, it would be the church, one would be a Black and so on, different affinity groups getting together and then having a session and to talk about how COVID has affected them. And it's not only going to be at the educational level. And one of the parents, an example, mentioned that, you know, I felt really bad that I have to have the mask and the clothes. Then when I came in, I have to go clean up before I can hug my kids. And now, after a year, my child is staying kind of away from me. So it's not the educational piece, it's the psychological aspect and all of that. So if anyone, I could send more information, I'm putting my number in there, I could send all of you the information. And if you would like to join church, Black, brown, you name it, there will be an affinity group for all of that. So if you would like to participate, because we really want to hear from you guys to see how you have been affected by this. So thank you, Brenda, and I will put that.
Welcome.
Thank you so much. And keep up with what you do, guys.
Thank you. Thank you.
Thank you so much for that. That was really interesting. Both of my parents were actually born in Haiti, so that's
Wow.
definitely something I'd
Wow.
be interested in. I do speak Haitian Creole, so like, please put that information there. I'm sure me and Jordan, I mean, many of our classmates are also people of color, even non-people of color would be very willing to participate in that. And I want to thank you for taking on talking about the religious aspect of the vaccinations, because that's something that, again, I'm sure Dr. McAdoo can talk about it, because we did have like an interfaith event a couple of weeks ago. And it's very important to recognize the different aspects of people's lives and how that relates to COVID as well as the vaccine. So thank you so much for sharing that.
Thank you. And that will include everyone. So I think I have.
We're also doing some outreach efforts too, which Chanel is helping us with from Maywalk in the Worcester Central community as well, to reach out to that broader population of faith-based organizations, you name it, as we're also helping to be part of that community outreach here in Central as well. So that's really great, so that we could spread it across the state, which is really good. We do have a question, and I want to be mindful of time in the chat. When can I go without my mask after being vaccinated, and when do I absolutely need to wear a mask?
Great question.
And I think we will
Is a
have that close us out.
That is a fabulous question. And one place to quickly look at that, and I don't know if someone might be on the CDC website, they do have this little chart that's really great. That kind of gives you both picture and like a green and red, and it shows a mask, but it helps you to understand that. But first is if you are with people who have been vaccinated, small group, like if I'm with another family, one of the family, if I'm seeing my cousin and she's been vaccinated and they come over to my house, that is okay. I think places where you really have to pay attention, even if you're vaccinated, because of what Jordan shared about the variants, things that are still changing, so it's not perfect, means that if I go into a place where there's a group of people that either are not vaccinated or a larger group. So as the gathering gets bigger and bigger, first, I still recommend that you do not go to big gatherings, but if you are entering, whenever I'm going to any place where there is a group of people that I may not know, if I'm going grocery shopping, where I'm going to public areas, I am always wearing my mask, even though I have been vaccinated. And I have kids at home, so they have not, the younger kids have not been vaccinated, but the adults have. Nevertheless, I still wear that mask in public places because you still have to protect yourself. As Jordan said, there's still variants that unfortunately we're still learning more about and maybe circulating, and you want to make sure that you stay protected in larger groups. But there's different categories that explains to you when you should, so if you're vaccinated, when you should wear your mask. Most of the times where you don't need to wear your mask if you are around others who are who have been vaccinated. That's usually in general a time where you don't have to wear your mask. But being in outdoor, out in public spaces or larger groups, I think it's very important to understand to continue to use your mask, the same mitigation efforts that you have used, which is trying to stay out of larger venues, keeping your mask on, making sure you're doing the hand washing, all those traditional things, continue to do that. Because honestly, in life, even during flu season, that is the way that you stay healthier, is by washing your hands and making sure that you are staying healthy. That's the other part I wanted to mention. Your health, keeping track of your own personal health. In other words, sleeping well, trying to eat the best that you can, and exercising. And when I say exercising, that could be going for walks. Those things help to make you healthier. And that in and of itself is also important in that, in addition to wearing your mask and all those other things. So I just wanted to leave you and I'll find that link as you're closing from the CDC that gives you that little chart that helps you to see, when you should wear your mask and where it's okay not to.
Thank you,
we put
Dr.
that in the chat,
McAdoo.
Dr. McAdoo. Cassandra and I put that chart you were talking about in the chat.
Because I'm using that too. I actually took a picture of it on my phone. I have it on my phone, and I can now make sure, that I'm following that as well. And another thing that both Cassandra and Jordan mentioned is keep on top of what's changing. We get new information every day, literally every day. And how quickly information disseminated is really fast. Sometimes it's not even filtered by the time you are Googling it or you see it on social media. So the key thing is to ask questions. Ask questions. So your health provider is the most important person who's going to give you that information. 2 is look at your source. You have to be an active consumer now. This is not passive anymore. You have to look at your source and you have to question your source. So if I'm looking at the CDC, I'm like, what does the CDC look? Let me see what do they, okay, I should trust the source. If I see this name that I do not recognize, I'm like, what do they do? Oh, I don't know. That doesn't make any sense to me. So you have to now be an active participant in your education. So being informed is different than being knowledgeable in something. I could be informed because I'm looking at the internet and I'm reading about something. So I know that there's a vaccine out there and I know that it's for COVID, but to be knowledgeable it's important for you to ask questions in order for you to be knowledgeable, and the more questions you have. And lastly, I just wanted to add to that, because this is something that I know I had a long conversation, I think it was with both Jordan and Cassandra. The way that science works is that it evolves over time. The way that science works is that we're supposed to ask questions. The questions you're asking, well, how long does the immunity last if I have a vaccine? We are still learning that every day. So in science, we continually ask questions and we continually get answers that might tell us that we're right, we're not right, or we need to ask more information. That's important because the issue of trust and hesitancy says, well, I read this today, yesterday, but now today is different. It's supposed to be different because we are learning new information every single day. So that's actually good. You just have to make sure that you're getting it from the right source and know who to ask if you have additional question, which should be your health provider.
Thank you. Celia?
All right, well, thank you, ladies. Do you want to just give one last closing statement before we go? 30 seconds, and then I will close us out.
Yeah,
Cassandra or Jordan, go ahead.
One thing we did want to add is we made a little survey, a post survey for anyone who attended the session, just to see your thoughts, if you had any feedback for us, any further questions, if you think of later. So I'm going to make sure I put that in the chat. So if you guys would just click on that link, it's a quick little, oh, Chanel put it in for us. It's a quick little Google form to fill out just after, it should take 5 minutes after the session today. Thank you for everyone for coming. So great. I'm really excited that you all made it. I think this is a really good discussion.
Yeah.
The only last comment I want to make is that these two future doctors you see, they're going to be powerhouses. So I am honored to be here with both of you on this panel. And I appreciate you inviting me to this. Thank you.
Thank you, Dr. McAdoo. Thank you, Jordan and Cassandra. They definitely are going to be powerful.
This
Cassandra?
session was recorded. So also, I think we're going to post the recording. So if you know anyone that would benefit from watching it, or if you have any questions you want to watch back later, it should be posted for you to watch later.
Cassandra?
Yes. One thing I always want to recognize this is I understand that me and Jordan, thank you, Dr. McAdoo, for being here with us. It's an honor to learn from you every day and can't wait to see what the next 4 years holds for us. One thing I do want to talk about just a little bit is that me and Jordan and Dr. McAdoo and some of the people here definitely recognize that we've been studying science for a very long time, kind of since first grade and kindergarten, and not everybody has those same experiences. And I think Brenda touched on this. So when people are like, what did you do to make that decision for you? My first thing is like, oh, I did research. And I understand that even for like my parents and my grandparents and some of my cousins, that's not something that they can just go to CDC and read those stacks of like papers and charts. It's not something that is definitely digestible for a lot of individuals. So part of our mission in public health, like definitely infectious diseases are super important, but public health is how do we get that information in a digestible way and for them to understand it. So just saying like do your own research, we understand is a very elitist position, and it's something that we're trying to, if you have any feedback on how we can get that information more out to the community, we'd love to hear that, because that's something that's changing every year. So we definitely recognize that.
True.
Well, I just want to say thank you so much for being here with us today. I want to first thank the team who have been, you've all been working together on this, which has been Brenda, our leader. We've got Carolina, we have Chanel, who's also been part of this, and Chanel is not well. She probably shouldn't even be here with us today, but thank you, Chanel, with all that work you did. I'm sure you're like, I'm not missing this. And of course, Jordan and Cassandra for being involved with us at Maywalk and in your journeys. Dr. McAdoo, you're just amazing. And we also have Dr. Forrester here with us, who's also doing a lot of the, I think, community engagement, and had put something in the chat. So we look forward to really building partnerships where we can get our communities more involved and to be more comfortable and empowered during this process. And I just want to, I took some notes as you spoke. We know that these are personal decisions that people need to make for it. We recognize that and honor that. Talk to your doctor if you are just still concerned and don't feel like you have enough information. We shared about why this time is a little bit different than many years ago in terms of there are more people that look like us that are at these tables. So that's really encouraging to hear, although we want more. And that, you know, you are going to feel some side effects. That's okay in terms of illness or your arm is sore. But the key thing to know is that getting a vaccine, regardless of which one they are, that is the most important, because it is going to help us to prevent us from hospitalization. And as a lot of you all know, our communities of color have been impacted the most. And so we wanted to make sure that as this session brought forth today, that we were doing our part as well here at Maywalk to make sure that we were getting information out to our communities and that we continue to be very much a partner in all of this fantastic work and helping to further our especially our women of color in the field to be there to help support you as well. So with that, I am going to sign us out. And for those of you who are mothers on the call today, I want to personally wish you a happy Mother's Day weekend. Please make sure that you put your feet up and take a little time for yourself. We don't usually do that too often, and that goes from me saying that as well. And so I hope that you do. And I can't wait to keep having these types of conversations and engagements. And please check us out on our Facebook page. We try to update that as much as possible. And we've got a lot of exciting things going on this year that we'd love for you to continue to be engaged with us on. So with that, have a wonderful weekend and thank you again.
Thank you, everyone.
Thank you so much. Thank you.
Bye.